Good afternoon, everyone. Thanks for attending our weekly webinar where we provide information related to COVID-19 for the homeless services providers in the continuum of care. My name is Nicole Bahina, and I'm with All Chicago, and you'll be hearing from All Chicago staff, mostly myself, DFSS and Cdph staff throughout the presentation today. Next slide. By now, most of you are familiar with this housekeeping slide, but in case there are any new folks on, we just want to highlight a few things. We try to keep everybody on mute, but you actually do have the ability to unmute yourself, and we just ask that you don't do that, only because we typically have well over 100 people on the call, and it can just get really distracting with noise, so please be cognizant of accidentally clicking on the unmute. And we will be fielding all questions using the chat tool, so make sure you have that toggled on, and you can do so by clicking the chat bubble on the bottom of your screen. And if you have any trouble hearing us throughout the presentation today, you can use the icon at the bottom left-hand side of your screen, audio, to either join by calling in or switch to joining by using your computer. And with that, we can go on to the next slide, and I'll turn it over to Maura to go through the agenda today.
Hi, good afternoon. This is Maura McCauley from the Department of Family and Support Services. Today, our goals are to continue to share out updates from the city response to COVID-19 and to ensure that we're getting quality and complete information out to the homeless services community within Chicago. We hope to hear from homeless service providers about challenges and gaps that you are facing in the COVID response in real time, and then again to provide updates and build shared ownership of the goals and plans as we kind of start thinking about recovery. Next slide. As you know, each week on these webinars, DFSS, Cdph, and All Chicago are sharing out updates on pieces of a larger strategy for protecting and supporting the homeless population and homeless service providers during the COVID pandemic. To help orient us today, we wanted to begin with sharing out the big picture of the key components of our current response. As the crisis continues, we are working to continue strengthening the response in each of these buckets. We're not going to walk through each of these buckets in each detail every week on this webinar, but we will continue to provide key updates and important reminders within each of these buckets. And as I just want to take a minute before I hand this over to Dr. Jasmine from CDPH, just to reflect a little bit. As I look at this slide, you know, this is not an exhaustive list of everything that is happening within our system and with other system partners and people on the ground and people experiencing homelessness. And you know, I think I'm at a moment this week. We do this. We have these phone calls every week. We talk to each other every week, and we do a lot of sharing out of information. It's very business focused. But as we've been taking some time to really reflect on pulling everything together to help us see, you know, from a 100,000-foot view, what's happening in our response, you know, this is really tiring. I've had a number of conversations with my own team this week. We're feeling tired. I've had conversations with many of our really important partners in the community, you know, particularly within our shelters, though that's not, you know, the extent of where the response is happening, where people are feeling tired. People are feeling concerned. This crisis is going on, you know, for longer than, I don't know that we believed it would really be short, but it's going on for a while now. And so I just, when we get into the CDPH part of the presentation, Dr. Jasmine is going to share out some of the early, you know, reports about the results of testing. And, you know, it's just a reminder to me that these conversations that we're having are so important to make sure that we're doing everything that we can to, really limit the impact of COVID-19 on our system and the people that we're really working with. But this is real. There are parts of this is an evolving medical crisis. There are things that we can do that are within our control, and there are many things that are not within our control. And just want to take a moment to really appreciate all of the time and effort and the real kind of blood, sweat, and tears that is going into this response. It's not perfect. There are gaps, and that's what we're going to continue to talk about, as we always do, about how do we come together, not just one system or one city partner or one agency, but how are we all brainstorming to do the best that we can do. I want to say thank you as we get into talking about, the results of the testing strategy. We're talking about real people. We're talking about staff of shelters. We're talking about, residents of our shelter system and outside of that. And I just want to acknowledge that this is a real impact on real people. And while we spend a lot of time talking about business and strategy, which is equally important, I don't want to lose sight of the fact that people are feeling tired. And I don't want to be a downer here, so I do want to turn this around and say that I'm very hopeful that we have so many people joining these calls every week, so many people working outside of these calls in your own organizations, in your own collaborative spaces, in new collaborative spaces, to really innovate and continue to do, I think, what our system does best, is to be nimble and flexible and step in where we can. And I know that we will continue to work together. And that piece of this is really motivating to me personally, and I know to our team at DFSS. So I want to say thank you, and just really acknowledge that we're in this place where, this is going on, and we're gonna come together to figure out how do we continue to take care of ourselves, continue to take care of our teams, and most importantly, the people experiencing homelessness that really is the mission of why we're all here. So thanks for letting me go off script for a few minutes. And with that, I'm going to turn it over to Dr. Jasmine to take us into the updates from CDPH.
Hi, everyone. Thank you, Mara, for acknowledging the fact that this whole process has been very tiring. It's good to acknowledge it, and then just to remind everyone that we are all in this together. This crisis has us wearing multiple hats, and then we're having duties that are new to us, and then adjusting to the changes on a daily basis, and sometimes several times a day. So thank you again for acknowledging that. Every week, I usually begin with an update on the current status of COVID-19 in the city of Chicago. And as of yesterday, we've had 34,413 cases of people who were diagnosed with COVID-19. And then we unfortunately had 1,552 deaths in Chicago. This is an increase of 1,293 cases and 53 deaths since May 13th. If you look on the bottom, you see chicago.gov/coronavirus. You can also access this information on the website. It's updated daily, and there's also, that website's also rich, full of other types of information and resources. Okay, next slide. So what's new since last week? We have, the city has opened a survey on reopening the city, and it's open to everyone living in the city of Chicago. So all of our listeners today, I encourage you to share this with your colleagues, your friends, and family members. The city really wants input on with devising a strategy for opening the city in a safe way. It's asking information about like the top reasons why it's been difficult to stay home. Has it been like a lack of productivity or a lack of social interaction? Are you able to practice social distancing? How have you been coping during this time, during the shelter in place order? And what supports are needed to reopen? And even asked to prioritize the types of businesses that should be open during the different phases. So I encourage you to visit our website and then fill out this survey. Should take a few minutes. I think it's 16 questions in total. Okay, next slide. Also new since last week, the city has opened up 6 testing sites. So on the left side of the slide are the City of Chicago sponsored testing sites. These, the first one listed was opened on Wednesday, and then you see there's one more open yesterday, and then today opening is at the Jorge Prieto Math and Science Academy. There are 3 more sites that are planned to be opened in the next few days or maybe week or 2. Most of these, so all the sites will test symptomatic residents with the exception of the guaranteed rate field lot. That one's for first responders, healthcare workers, and other essential workers. That's also the only site that is fully drive-through. The other sites, you have the option of either driving, and we know that many people do not have access to cars, so they also have walk-up services. If you want to have a test, we ask and recommend that you register on the website that's listed, chicago.curativine.com/welcome, and you'll be able to pre-register. It makes it easier for planning if you're able to pre-register, but it's not 100%. It's not 100% necessary. If for some reason you can't register, you can also walk up. On the right side of the slide, these are additional testing sites. This can be found on the Illinois Department of Public Health website. You could search according to your zip code or your specific address for the closest site near you. For these sites, I do ask that you'll be provided the contact information. Please call the sites before you go because some sites, they may be limited to whether or not you're already a patient at the site. So it's good to call ahead to make sure to see if that's the case. Okay, next slide. Okay. And so this slide, we have 2 different types of housing solution. One is the general isolation. The other one is supportive isolation. The general isolation are private rooms within a hotel and is intended for individuals who do not need additional medical or behavioral health support. For the supportive isolation option, that one is intended for individuals who do need that support, the medical and behavioral health support. We know that for those experiencing homelessness, they tend to have multiple comorbidities, whether it's physical, medical conditions, or behavioral health conditions. For the most part, most of the clients who do test positive will end up in one of our supportive isolation solutions. There are 2 different locations, and we'll have our nurses come in to help reveal the results if we have our testing team come to your location, and then they'll help with filling out the intake form, which will also result in us arranging for transportation to one of these isolation facilities. Listed here is the isolation period, which is 10 days from the symptom onset or 3 days where you're afebrile without a fever, and improved symptoms without any medications that are used to reduce the fever. So whichever one's longer. To visit the website that's listed here, if you click on it, when our nurses come to visit the shelters, they'll also provide some guidance on how to fill out the the intake form for making the referral to one of these facilities, but it's mostly very self-explanatory, but we just want to make sure that you feel comfortable filling out the forms. When you get the slides later, please save this website and bookmark it for in case you need it in the future. Next slide. So some of you, for those who are new today, you may be asking how does a shelter get chosen to have a rapid testing team come visit to perform tests on all the clients? Well, we usually rely on feedback from each shelter. On the right side, there's a blue box. We ask that for those shelters experiencing 2 or more cases, that you use that link to fill out a reporting form that there are positive cases at your location. Once that information is provided to Cdph, that triggers a rapid testing team to be deployed to your location. We would give the location a call before anyone shows up to arrange a time for the testing team to come. This is done in partnership with Rush University, UI Health, other organizations such as Longdale Christian Health Center, in addition to Cdph and DFSS. We're all working together to organize this testing to coordinate all the steps. And the testing team, once they arrive to the facility, what they do is they will test clients and staff who are both symptomatic and asymptomatic. Usually we try to trace who were the close contacts of the person or people who were positive and try to test those members of the shelter. Once the samples are collected, we would get the test results, and then we would have our CDPH nurses come and deliver the results to the individuals who are positive. Also, we'll help the staff members fill out the intake form to make the referral to the isolation facility. While our nurses are there, we're also going to be providing guidance, personalized guidance for infection control practices, and if there is an area in the shelter where isolation can be completed, we also, just to make sure that infection control is especially important in those cases, we just want to make sure that everything is done correctly, and if you have any questions or any uncertainty, we'd be able to provide information on the spot. And so CDPH will provide the results to DFSS and the designated shelter representative within 1 business day of the results being reported to us. And so right now we do have some testing data available. I know in the past we've had questions about what are the results of all these tests that we've been conducting within the shelters. If you visit this website, you in the last bullet, you'll be able to see some of these results. Next slide. And so just a broad overview of the results that we've had, some of the key findings as of May 10th. We've had 1,853 shelter residents and staff who've been tested for COVID-19 in a total of 27 shelter programs all across Chicago. There were 475 residents and staff who tested positive for COVID-19. And then on average, the percent of people within a shelter who tested positive for COVID-19 is 25%. And this is what we have been seeing in other major cities. However, over the past 4 weeks, the average percent positivity rate in shelters with at least 1 reported case has been below 15%. That means that our infection control practices have been working. So when the cases are reported to us and then the guidance about infection control once the cases are known, we're helping to prevent further spread of COVID-19 once we know the positive cases are there. And so another thing, we tend to see lower positivity rates in shelters in repeat rounds of testing. This indicates that the efforts to stop transmission within the shelter are effective. Next slide. And these are the testing results. So on the left side of the slide, um, each red represents positive cases and blue represents negative cases. And then each horizontal line represents a testing site. And you'll see it's listed in order of percent positives within the site. And so you'll see it's not an automatic given that if we do know that there is an outbreak, meaning 2 or more positive cases within a shelter, it doesn't necessarily mean that there's widespread transmission of COVID-19. So while we do see in the first few sites, you do see about 60% or high 50% positivity rate. There are also sites that have less than 5%. Some sites where we conducted tests and we did not find any positives. So it's highly variable. And then on the right side of the slide, also positive is still red and negative is blue. This shows the results over the past 4 weeks, where at least one case has been reported. You'll see on average the positivity rate is below 15%. And so we are seeing decrease outbreaks and the slowing the rate of spread through the interventions that you are helping to implement. So I thank you for all of your hard work. Next slide. So this, you probably have heard different iterations of me saying this before, but it never hurts to go over this material. So what is the role of the shelter staff in reducing spread? So how can you talk to your staff about reducing the risk of staff introducing COVID-19 to your facility? We do know that there is community spread, and so despite the efforts that are made within house, we do know there is also the possibility of coming in contact with COVID-19 outside the shelter system, whether you're when you're carrying out your essential activities such as grocery shopping. So when not at work, we ask you that you follow these best practices to decrease the chance of contracting COVID-19. So things like washing your hands often with soap and water for at least 20 seconds. Stay at home as much as possible and avoid close contact with others. Close contact meaning within 6 feet for more than 10 minutes. Again, put 6 feet of distance between yourselves and others while in public. Don't worry about offending the person that you're walking by. I'm sure they'll understand we all are in this together. And then we recommend that you wear a cloth facial covering when you are in settings where you can't maintain a social distance. These settings include grocery store and pharmacies. These are the top 2 areas where people tend to visit regularly when they're not home. And then finally, to clean and disinfect frequently touched surfaces daily, even some multiple times a day. So things like doorknobs and light switches, phones, faucets, all of those, even the handles for your refrigerator. It doesn't hurt, and it does decrease the amount of germ load onto these surfaces. Also, for staff members, we recommend if you're not feeling well, if you're feeling sick, even a little bit sick, please stay at home, except for when you're seeking medical care. And then if essential staff that are not essential to your operations, we advise that they stay home as well and be ready to come in the event that there is a staff member who is sick and not able to come to work. Okay, and I think that's my last slide. Is there anything? Yes. So be happy to answer questions.
Okay, so Jennifer from All Chicago has been doing an amazing job putting all the links that you referenced up in the chat box.
Wonderful.
So I think there's a lot of information to digest based on what you shared, and we don't have questions in the chat box, though I imagine they will come up. So
yes.
If they do, we will, like we always do, take note of those and then, bring them back to CDPH for a response and share back out with the rest of the community.
Okay.
So thank you so much, Dr. Jasmine.
Yeah, you're welcome. Thank you, everyone.
Okay, so moving on to the DFSS updates, a few reminders and updates today around shelters. With shelter decompression, we've opened 5 temporary sites providing 700 beds. We are currently in conversation with our partners about the continuing role for these facilities as the crisis continues, thinking about midterm solutions to make sure we can support our existing shelters in remaining at safe levels of social distancing. So no real updates on this today. We may have some in the near future, though, as we are able to speak with our various partners and do some planning around this. Clients who are identified as high risk for complications from COVID are still being assessed by our partners at Lawndale Christian Health Center and relocated to hotel rooms. We've completed at least one wave of the shelters identifying the congregate facilities, identifying their high-risk individuals. And as people come in through inflow, Lawndale continues to assess them. To date, roughly 170 clients have been moved from congregate settings so that they can safely isolate. And at this point, all of our shelter programs have received an on-site nurse visit for in-person support with keeping your facilities safe according to public health guidance. So thank you so much for your collaboration with DFSS, CDPH, and the nurses to make this possible. Next slide. As a reminder, all referrals are continuing to come through 311. We continue to work through any issues that are getting reported as people are trying to access shelter through the 311 process. So please continue to let us know through the DFSS homeless email, and we will continue to work through those individual problems, but this really helps us understand what is happening and to resolve issues going forward. We do acknowledge that this is not a perfect process, and there continue to be glitches in the system that are impacting connections to shelter, but we remain here to work through them. We also wanted to alert our shelter programs that clients have begun discharging back to shelter from isolation facilities once their isolation period has been completed. So some of you have already started receiving clients back from these facilities, and the current process for discharge is building on the success of that coordination so far. Very simply, when a client returns from an isolation facility to your shelter will be contacted by the isolation facility discharge staff to work through the transition process. Clients will also return to your shelter with a letter from the isolation facility that details their clearance to return. I know that there have been just questions and concerns about when people are ready to return, and the discharges are happening based on the CDPH guidance and the clinical assessments of the isolation teams. And so really that work will happen between the shelter and the discharge facility. It will not have Catholic Charities placement involvement unless we have, you know, a bed availability issue and or somebody is new, you know, went to isolation and needs a new shelter placement, in which case you would also get a referral through Catholic Charities trying to place a new client, but you would still be in connection with the discharge facility staff to have that direct contact with them. So this will be something that we continue to work through and monitor how that's working for everyone in the coming weeks. Next slide. So just a reminder, we're rehashing as we get into this longer and longer. We're also taking a few moments to rehash some reminders that we've shared in previous weeks, but not recently. But a few questions have come up about how the shelter referral process is happening and the different paperwork that you might see as a shelter receiving an incoming placement. So just a reminder that not all referrals will have the standard intake form from Catholic Charities. We have contracted with an additional transportation support through SCR Medical Transport, and clients who are transported by SCR will come with a modified intake form, which is the image that you see on the slide. So it will not be the Catholic Charities intake form that you're probably accustomed to. Catholic Charities is conducting the public health screener with clients over the phone before they are transported to shelter. If a client is transported by Catholic Charities, they will have this health screener on paper, but if they're transported by SCR, you will not receive this paper, but they will have been screened over the phone. So if you get a referral that looks like this with no health screener, it just means that they were transported by the supplemental transportation company. Next slide. Outreach is continuing during the crisis. Continued focus on COVID-19 awareness and response. We are working with Cdph and the testing partners to begin coordinating testing in encampments. And as soon as we have updates about that, we will share that. Next slide. Lastly, here's an important note about the DFSS RFP process this year, which I'm sure is going to be of interest to our delegate agencies. So because of the COVID-19 crisis, DFSS's 2021 CDGA RFP process has been canceled. So that means that our delegate agency contracts will be extended through December 31st, 2021. Our DFSS contract division will be, at the appropriate time, the contract division will provide delegate agencies with contract documents to complete for those extensions. Like you always do, we will need to complete budgets and scopes of work with you through our regular process for review and approval to complete the extensions, but we will provide a timeline later in the year. If you have questions in the immediate term regarding your contracts, please direct them to your assigned homeless division liaison. If you have a contract with another DFSS division, you should reach out to the relevant liaison in that division as well. You will be receiving official notification from Commissioner Morrison Butler very soon about this, so you'll have that in writing. Wanted to make sure that we share that with you today as well. Next slide. And at this point, I am going to turn it over to Chicago.
Thanks, Maura. So we just have a couple of slides today. One thing that's been on our minds soon, we've been working very closely with various city departments about the CARES Act funding and allocations, and we feel very good about the system funding recommendations that went in on behalf of the homeless system. And so just wanted to call out that there's, part of the consolidated planning process this time around will include CARES Act funding. And so once the public comment period opens, I think we'll send out a message from All Chicago, but it's just important, and it's a good exercise for people to be aware of and to kind of read through and, if necessary, provide public comment and feedback on the priorities and how the budget is being laid out here. So we'll have more information on that when it opens up. Next slide. And then, like Maura said before about kind of re-amplifying some of the main messages we've been sharing on prior sessions, as we think about this expedited housing initiative and are moving towards housing people more quickly than we've ever been able to before, one of the main barriers that we run into and why our average length of time that it takes to get someone into a house is so much longer than we would like it to be, is because we don't have yet a solid and coordinated landlord engagement effort going on. And so All Chicago has been working over the last couple of months to really expand the work that we have done as an agency for our rapid rehousing agencies and expand it to the entire continuum. So we need you to help us add landlords to our list. There's a link here that we can put in the chat about what landlords can do in order to plug into this effort. And then if you also have staff that do landlord outreach and want to figure out how to benefit from a centralized list and or contribute to a centralized list, please email us at cocprograms@allchicago.org. And as protocols are developed for how this is going to work across the continuum, we will share more. But if you have feedback or thoughts, we would really like, when we say plug into this effort, we're really relying on our partners to help us shape this, and so we just need to know if you're interested. And so the way to do that is to email us, and we will add you to the group of people that is working on this. Next slide. Great, and then earlier, I believe it was yesterday or last week, I can't keep it straight anymore, but we invited Dr. Evan Lyon, who's the Chief Integrated Health Officer for Heartland Alliance Health, to do a question and answer and information webinar about PPE, specifically geared towards the homeless system. So we have a recording and a summary, and those are posted in our Chicago COC Slack channel. You can look at the actual channel dedicated to webinar summaries, and some highlights and questions that you can get answered by reviewing that information are on the slide here, but things like, are surgical or cloth masks safe? What is the right way to put on and take off PPE? Should providers use gowns, gloves, and face shields? Or what is the impact on the safety if residents are not wearing PPE? So just a resource for the community there. We encourage you to have your staff listen to it, and hopefully it'll spark some good discussion and best practices throughout the continuum of care. Next slide. And this is the last one, so hopefully you're in Slack already, where we post all of these great webinar summaries. So we always try to post the slides and a webinar summary for those who couldn't make it of this webinar in our Slack channel within 2 business days. So early next week we'll get it up there. And if you haven't joined Slack, please do, and Jennifer just dropped the link in there. And that's all the updates from All Chicago today. And if you want to go to the next slide. And we'll pause here. Maura, are there any questions that DFSS wants to answer while I look through some of the other ones?
I see one question here asking, would 311 advise an unsheltered individual that shelters do not have capacity? It's very challenging, I think, for callers to recognize the difference between the 311 operator and Catholic Charities, who is receiving the shelter request. So I'm just going to respond to this by explaining that when you call to request shelter, the person who takes the initial call from 311 will not be advising that shelters do not have capacity. They take the request and they submit a service request to Catholic Charities. When Catholic Charities responds to that call, because they manage the bed availability, they may, if there are no beds available, they may inform somebody that there is not a bed available. They keep the cases open for 24 hours, and if somebody does have a callback number, we'll call back if the bed availability changes. I know this is a question and a challenge that is continuing to rise up. So this is something that we're closely paying attention to between 311, DFSS, and Catholic Charities. I'm not seeing any additional questions that don't seem to have been responded to in the chat box already, Nicole.
Okay.
So I think, is there anything that you want to respond to?
No, I think we're all covered, so we can move on to the next slide.
Okay. So this is just a reminder about how we started this conversation about shifting to beginning to think about recovery in our community. And so, you know, we have been mentioning, I think, over the last few weeks that we hope to use this webinar not just to share updates on COVID response, but to begin orienting the community towards recovery. And so here's what we previewed last week on our thinking. And we asked you through the chat box to share, you know, the questions that you have on your mind and the things that you're already thinking about within your organizations or within your personal situation. And I just want to say I thought that response in the chat box was really awesome. And so we can go to the next slide. Of course, this is not the final final option to respond. This will be an iterative process, but we wanted to reflect back the types of questions that we heard from you on recovery, specifically, you know, in the kind of the buckets of what does recovery mean for prevention, outreach, shelter, and housing, and then how far out are we looking for a recovery period? You know, people reflected questions and thoughts around homelessness prevention, the shelter footprint post-COVID, employment, education, continued healthcare sector partnerships, ongoing COVID testing and patient support, and ongoing need for PPE. So this is really just a quick summary of what everyone shared last week. If this prompts any questions, any additional questions for you on recovery, please share them in the chat. We'd love to hear any new questions that came up this week as well. And so we will be working together as a team to begin to really kind of reframe these webinars. It'll take a bit of time to kind of organize what that looks like, but you'll start to see, I think, in the next few weeks, a little bit of a shift in the way that we're presenting and some of the questions that we're asking you to think about. But please feel free in the interim to reach out to Nicole at All Chicago or me at DFSS or really anyone that you know on our team to let us know in between if there's anything in particular that would be important here for us to be incorporating. We can go on to the next slide. And so let's see, just a reminder, as we always close with commitments and discussion of next steps. So we will continue these weekly joint webinars, and they will be posted on the All Chicago Slack channel. Again, we ask you to continue making sure all of the relevant information gets circulated throughout your organization. Please keep DFSS informed. We're really expecting you to keep us informed about any staff shortages, changes in bed availability, suspected or confirmed COVID cases, and then issues and concerns via our DFSS homeless email. And before we close out, I have seen a few more questions come into the chat box. So,
yeah, and I think I can answer one of them from Constance about updates on the second round of emergency funding. So I think it might have just gone out in an All Chicago email, so I'm hoping that is the case, but we basically were trying to get announcements out today or on Monday for those agencies that were selected for funding. So we can share more information about that at a future webinar. And I'm still hopeful that there will be funds continued to be directed towards this from private philanthropy. So if there is another round of funding open, we'll make sure to share that information as well.
There's a question here about whether DFSS audits and monitoring be postponed or canceled this year, and this is a question that we'll need to take back. I'm not able to answer that at this point in time, but we'll take that back and make sure that we provide updates about what that will look like going forward. There's another question around childcare resources, which is not something that I can answer. And I'm not sure if that's something that you guys have a resource that you can speak to, Nicole, or just something we'll come back to.
Yeah, I mean, I think that's a perfect example of a question that is so broad that it really goes beyond, what we would typically talk about on this webinar, but is a perfect question for the Slack channel because there might be other resources that people know of. But if we have something else to share about that, we can bring it back at a future session. I would welcome anyone else to put in the chat any thoughts or ideas for Sharonda's question.
Mm-hmm.
And then I don't think we addressed Felicia's question yet about whether coordinated entry assessments will be used to determine who's eligible for expedited housing, and the answer is yes. So we have not changed any process related to coordinated entry assessments being sort of like the initial step before matching someone to housing. And the only thing that has changed that we've been talking about on previous webinars is the prioritization criteria, and we are actively working to kind of just give a little bit better information about how that has changed and how it relates to the homeless system more as we look out in the next couple of weeks too. So we'll be able to share more information on that next week.
A few questions around testing came in. The question from Lisa around who is included in the information from the shelters, it is not just DFSS funded shelters. It includes, and I think in the brief, I think it may define what types of facilities are included, but it is not only DFSS funded or supported shelters. And then Andrew, your question around reporting to DFSS, even though CDPH is tracking the results, that's a really great question, and one we actually talked about as we were continuing to add this into the slide today. We really want to know from the DFSS side, just so we know what kind of support you might need and just so we can be checking in. Reporting to CDPH is really the critical piece. As the testing strategy is really becoming a bit more formalized, we are also seeing the results. So if it's really hectic and you don't tell us, we will get it. We will get the information. We just appreciate awareness if you do have a case, because it does also trigger us to do some follow-up with CDPH to find out if we need to pause referrals, and just to kind of help places further up in the response system be aware. So that's really the reason, just really for us to support you and for us to make sure that we are pausing referrals and not sending anyone if it's not appropriate based on public health guidance. Okay, I think we are through. If there are questions that we did not respond to, we will get to them, I think, after this webinar. Thank you all for your commitment and your ongoing work. I hope you're all able to take a deep breath at some point someday on what we call a weekend, which doesn't feel like a weekend all the time anymore. But again, thank you so much, and we will speak to you next week.